everyone. Welcome to the Ennis Heritage Society and a second lecture of our winter series. My name is David Sachin. I'm recording secretary for the association, and it's my pleasure to welcome you all here tonight. I've asked Steve Knatzer, who is a member of the Presbyterian Church here, to give our invocation. Steve, please.
Very good. Let's bow our heads. Our most gracious Heavenly Father, we give you thanks for this day and this gathering. We ask that you will watch over our endeavors and give us guidance. In Jesus' name, amen.
Amen. Thank you, Steve. And we're very grateful to the Presbyterian Church of Ennis to welcome us again tonight and to use their parish hall for this lecture. We have one more lecture planned for the winter. Of course, we didn't plan this much winter, but in any event, we do have one more planned for March. We expect the library to be reopened by that time. So we'll be able to go back to the library auditorium where we first started having these. And that'll be our last one. And that one in March is going to be by our board member, Dave Lindauer, who's here this evening. And he's going to be presenting the research he's done on Edgar McElroy, who's a native son of Ennis and one of Doolittle's raiders. And if you don't know anything about Doolittle raiders, come next month. Dave is going to have a lot on that. So you'll all be getting an email message for that, reminding you of that invitation. So as I said before, this is our 43rd year as an organization. And so we were established in 1981 as a grassroots volunteer organization to promote the history of Ennis and the heritage of our people. So we're pleased to carry on programs like this lecture series and to have a historic archive in the library that Bobby Delibai, over there, is one of the people who helped manage that and has probably helped move it back over to the library in that process. So we have programs like that and events like this lecture series. So hopefully you all have noticed that we have been video recording these lectures ever since the first one, and we make them available to the public on our website, our Facebook page, and also on YouTube. And our videographer is Casey Crow here in the back of the room. Compiles that, edits that, and then we post that. So they're available to the public. So that's one of our kind of services to the community. But Casey has started a service that he'll video record family members, giving an oral history of their family and things like that for the benefit of family members and all. So if you're interested in knowing more about that and what he does, I suggest you talk to Casey afterwards, after our meeting night. We'll have our, Dr. Kinzie will give his talk, and we'll have some refreshments here, and then that might be a time to talk to Casey. We've also brought some items from our archives here that we thought were kind of medical-ish. So you're welcome to come up here and look at these afterwards. This is not Dr. Kinzie's medical bag. I'm sure his is in better shape, but maybe it's been used a lot too. This is actually belonged to Dr. Cook, who was an Ennis doctor. And we have some things about the first Ennis hospital and the nurse, Zephyr Collier, who served in the nursery, right? Yeah. So you'll probably hear more about this tonight. Well, I haven't said much about, so I do have also the pleasure to introduce Dr. Kinzie, who practiced in Ennis for a remarkable 42 years, from 1964 until 2006. He graduated from Lindell High School, Tyler Junior College, University of Texas at Austin, Baylor Medical School, and then interned at Jefferson Davis Hospital in Houston. He served in the Air Force from 1962 to 1964, and maybe shared some flying stories with Dr. Gossett, who I guess flew in Korea, so a little earlier, but whatever. Let's see, he officed with Dr. Walter McCall downtown, and later in the, let's see, Dr. McCall's office in the Alexander building upstairs? No. Oh, okay.
No, in medical arts clinic after that.
Oh, okay, at over by the former hospital, I guess our second hospital.
With Dr. Lee.
With Dr. Lee, oh my goodness. Okay, so they office there, and then he also officed as a member of the Medical Arts Clinic of Corsicana Satellite Office in Chatfield. So Dr. Kinzie is a member of the Church of Christ on Country Club Road and chairman of the board of Myrtle Cemetery, where he now continues perpetual care of many of his former patients. I'm welcoming Dr. Kinzie, and he's assured me that he's not going to reveal any medical information about any of us in this room. So Dr. Kinzie, please come on
Thank you so much. Okay. I got to tell you, this picture is really pretty, but when I saw this building, all of the screens were full of cotton lint because the cotton gin was just a block down, okay? And it was still working until '66. So, and the new hospital, which is now standing, was built around this, and then they tore this down after the new one was built. Okay, why did we come to Ennis? That's a good question. You know, a person has several really critical decisions to make in their life. If they're going to accept Christ, if they're going to marry a particular woman, whatever they're going to do with their life and a life's work, and where they're going to locate. I mean, those are all really critical things. In regard to Ennis, I had a good friend who was a relative of Mrs. Ruth Gilpin. Now, I don't know whether anybody remembers Ruth Gilpin, but she was one of the members of the Writers Club. And they had a very active Writers Club at that time. Well, anyhow, we had visited with her several times. I knew David Kinzie, who was Joe Kinzie's son. He was the one that owned the Red Moon filling station. And Judge Kinzie was his first cousin, so that's how that fit in. I also knew the Griffith boy, Don Griffith, and anyhow, that was at the University of Texas back in '56. Anyhow, I was vaguely familiar with Ennis, and so as time got closer about the time for us to decide where to locate, we had visited Ennis back in '61 while we were in internship. We ate at Dan's townhouse and we stayed at the Geneva Motel, okay? But anyhow, I met Dr. Thomas and Dr. E.J. Scrivanik at that time. Dr. McCall was then practicing up over the Five and Dime store, which later became Hesser Drugstore. But anyhow, that's how we learned about Ennis. Dr. McCall had, in the meantime, built a small office building out across from the hospital, had a small office available. So, Walter and Louise McCall were really sweet to us, invited us in, so we came. At the time that I finished my training, they were drafting doctors, so I didn't want to go out 5 years and then get drafted, so I volunteered for the Air Force and left my internship at 3 o'clock in the morning and stepped into the Air Force that day. So I was there for 2 years. During the time we were there, 2 very significant things happened. The Cuban Missile Crisis, which scared the bejeebers out of us, and the assassination of President Kennedy. Both were devastating to us. The first day of practice, August the 3rd of 1964. We were on our way to the office. Mary Ann was my receptionist. And we said, well, we're going to be praying for the sick. Not for the sick to get well, but to come to us, okay? So the first day we had 5 patients. And I had a cute little Czech girl come in and ask if I'd ever delivered a baby. And Marianne said, oh, a lot of them, which I had actually. But at any rate, she was one of my first 5 patients, and we delivered her the next spring, real healthy little boy. Several weeks after I'd opened the office, one afternoon or one evening, I noticed Marianne had a bruise right there. I said, what happened? She said, well, you remember, you were doing something the other day and I got a little bit woozy and I sat down and fainted and plopped over in the keyboard of the typewriter and bruised my chin. So that's where the bruise came from. It was the summer that I first came here. I had an elderly Czech man stop me just as I was walking into the emergency room and asked me to see his wife. And I said, well, I'll be happy to see her. Well, subsequently, she has a big mass in the abdomen. And of course, masses in the abdomen most of the time are malignant. Well, I called my friend Lewis Gibson, the surgeon from Corsicana. He comes up, examines her, and we open her up, and she had a ruptured gallbladder. Well, we cleaned all the stuff out we could, and he closed her. Now, he should not have done that. We should have put a drain in her, but anyhow, he closed her. Sent her home. Of course, she had an abscess. I got her back, and for about 2 to 3 weeks in the hospital, every day I cleaned that wound out, and we had put a drain down in the gallbladder bed, so it was continuing to drain. But we had our own antibiotics, and so she would say, well, when do you think I'm going to go home? And I said, well, we'll have you home by Christmas. Well, that was in October, I think it was. So anyhow, I was just kidding her, of course. Well, we finally got her all cleaned up and cleared up, and she went home, and Christmas Eve, she came to my office and said, Doctor, I want you to know I'm going to light a candle tonight at the Christmas Eve Mass. You know, that kind of thing is the kind of patient that I want. I wanted people that were close. A little bit later, and it was a year or 2 later, anyhow, I was called to the emergency room one Saturday and to examine this lady, or the girl. She's about 20. And she had been in an automobile accident the day before, but apparently not hurt badly. But she was complaining of abdominal pain. Now, she was about that tall, had a waistline of 39 inches. Well, anyhow, I called my friend Lewis Gibson. He had a Tornado automobile, and I don't know, mine 67 or 8 or 9. Anyhow, it would run. Well, at the time, he had always donned a crash helmet. Would you believe that? And going 90 miles an hour, he was stopped out on 45. And he said, I have an emergency in Ennis. Fine. So he gets here. We operate on this woman. She had a 23-pound ovarian tumor, a benign tumor. It was bigger than a basketball, really. So he was always flashy. Oh, all right. So we took that tumor, and the biggest thing that he could find was a trash can with a liner. He puts this thing in there, pushes it out to show the policeman that we really did have a reason to rush down here. So we get down there to the emergency room, and everybody's looking at that thing. I said, oh my goodness, you know. But anyhow, it was interesting, to say the least. With that little girl, I remember she weighed 130 pounds when she came back for her stitches to come out. It was an amazing thing, but Lewis Gibson's stuff made it even funnier, really. I had a patient that worked for George Parr, the Duke of Duval, back in the 40s, actually. And he counted the ballots in box 15 across the table from box 13. Now, box 13 is where they had 250 some odd dead Mexicans' names. You remember? Well, I remember the 48 election for several reasons. Number one, I'd never seen a helicopter, and he was electioneering in a helicopter, so I thought that was really neat. They landed in the back of the schoolyard, and he met my dad and said, now, doctor, I want you to know that I'm against socialized medicine. You know, well, that's what they wanted to hear, or they thought we wanted to hear. But anyhow, you know, I remember one day there was a 7-vote difference, and one day it was like 20 or 30. It was finally 83 votes difference between him and Coke Stevenson, the other candidate. And when he went to the Senate, people would call him Landslide Lyndon, and it made him so mad, you know. But anyhow, our hospital administrator at that time was Aline Prestige, and Aline was from Ennis. Her maiden name was Marchbanks, and anyhow, she had been Boone Powell Sr.'s executive secretary at Baylor in downtown Dallas. So she went from there being our administrator. Well, this had to be about 66 because I had become the chief of staff. Now, you need to understand, in medical politics, the newcomer gets plugged in just as soon as he steps foot in the door because nobody else wants to do it. But anyhow, we had a Joint Commission survey, and I had kind of forgotten about it in the 65, I think it was. And as it turned out, we failed it. And I kept telling her, I said, you know, we're just not really ready for this yet. Well, I have a call from Dr. Arndal, who was the second in command behind Dr. Porterfield in the Joint Commission. Now, the Joint Commission is made up of the American College of Surgeons, American College of Physicians, and American Hospital Association. And they're the ones who examined hospitals to make sure that they were quality places. Well, anyhow, Dr. Arndal called me and said, you know Mrs. Prestige? I said, yeah. And he said, well, she has lodged an official contest to the failure what am I trying to say? Anyhow, she had sent a letter contesting that they lost this survey. He said, in the history of the Joint Commission, we've never had an official request for a redo, or a request to have this straightened out. He said, if I promise I'll come in September and do your survey, will you promise that you have Ms. Prestige withdraw that contested letter? And I said, well, I'll sure do my best, but you know how women are. Well, anyhow, she withdrew it, and he came in September, and we passed. Now, that was the first time that our hospital was ever Joint Commission accredited. It was in '66. All right. One of my more bizarre patients occurred probably 68, 69. This lady was a member of our church. As a matter of fact, I was her Bible class teacher. And I knew her casually. And I knew she and her husband were having problems. And I don't know how I found this out, but she had gone to see Phil Burleson, who was one of Jack Ruby's defense team at the time, about divorcing her husband. Well, she came to see me in the office once. She began to be really bizarre. And she came to our house one time, kind of accosted Mary Ann. And it turned out I was actually in her delusional system as her lover. Well, anyhow, we got this thing around so that her husband and I got to their house, and the preacher was arranged to drive the car. Her mother was there to take care of the kids. So we held her down, and I gave her a big shot of Thorazine, which is an antipsychotic drug, and put her in the back seat of the car, her husband on one side, me on the other, and the preacher driving the car. Now, that's called kidnapping. And I just prayed that we didn't get stopped by the police, you know. But we got her up to the psych hospital in Dallas, and they admitted her and treated her, and there's a very long history after that, but I'm not going to go into that. Anyhow, we did survive that episode, and I did not get into trouble for being in her delusional system. There was an entrepreneur in Ennis who saw me back in the early '66, and he was taking nitroglycerins by the handsful. And I admitted him to the hospital. We did an upper GI series on him and found he had a hiatus hernia, and of course you can have esophageal spasms, and nitroglycerin does have some effect on that, but not much. But anyhow, I sent him to one of my acquaintances from Baylor in Houston, who was a cardiovascular surgeon, and he evaluated him, and there just wasn't anything to be done. In the meantime, my friend was killed in the plane crash over here at Dawson, the Braniff Electra that went in '66. Well, this gentleman survived until 1970. He was one of a dozen first people to have coronary bypass surgery in the Dallas-Fort Worth area. And he survived for another 15 years, you believe. Okay, we had an open house for our little office on the corner. I We had an open house July 27th of 70. When we signed the note for the little office, it was $42,000, I believe. Marianne cried because she didn't think that we could ever pay that thing off. But anyhow, had the open house. That was on a Sunday. I had gone to church. I got called out, had to deliver a baby. I had a patient that came in with a broken hip. We hospitalized her. This was the last time my mother ever was in Ennis. She passed away in October of 70. When we came back after her funeral, I was obviously distraught. And I had a patient one of my obstetrical patients, we did a fetogram on. Now, a fetogram is just an x-ray of the abdomen. We did not have these sonograms and all that kind of good stuff at that time. Anyhow, we had done a sonogram on her, and I came back, it was Tuesday. I hadn't seen the x-ray yet, and so I'm zimming through things, and I always made an initial up in the right upper corner, which meant it can be filed. I have seen it, and I've done what needed to be. Well, I had initialed that and just plopped it down, and so Melba Hamill came back and she said, "You didn't tell me about this." I said, "What am I? Triplets." Well, the mother was to come in the next day, and she didn't have a telephone. She was there in my office, and so I said, "You know, we thought you were going to have twins." Well, I said, "You got triplets. You got 3. Well, the girls in the office said she got real quiet, and then she cried a little bit, and then she said, "What am I going to tell my mother?" And then she said, "What am I going to tell my husband?" Well, November 30th of that year, which happened to be a Sunday evening, I got the call from the hospital. Sure enough, she was in labor. I had another singleton that was in labor too, so we delivered the triplets. I asked Walter McCall to come and help me. I didn't know exactly what we were going to be in for, but it turned out she carried these babies to term, and they were 5 pounds 6 ounces to 513, and they all went home 3 days later with her, and they have been very healthy, you know. In regard to the things that have developed since I started practicing, there's so many things. There is a bacteria that infects the upper GI tract, which none of the gastroenterologists in the United States believed. People in Australia found, called H. pylori. And H. pylori is the major causation of peptic ulcer disease. And I used to joke and say, it takes a shoebox full of medicine. Well, that's about right, because it takes about 3 different kinds of medicine to treat this. As it turned out, I have had several upper endoscopic exams and several colonoscopies, and so I had biopsy-proven H. pylori. I got treated, I got totally cured, and biopsy cured, actually, proven by biopsy. But the general surgeons did an awful lot of surgery for years and years on chronic peptic ulcer disease. That's gone away. I mean, you just hardly see ulcer disease at all now. And the H. pylori infection is one of the markers for malignancies of the stomach and esophagus and duodenum. So we've cured ulcer disease and upper GI malignancies. Okay, HPV. Anybody know what HPV is? Well, I know you do, but it's human papillomavirus. And this is a major problem, causation of cervical cancer, and there are other cancers that do, but that's the major one. And of course, for years we did annual pap smears and this kind of stuff. Well, with HPV, there's a vaccine to prevent that. When the kids get it, if HPV is knocked out, there just won't be any more cervical cancer. But anyhow, those are a couple of the things. Also, fiber optics. You know, without fiber optics, we wouldn't have endoscopic exams and colonoscopies and operations with scopes, all that kind of stuff. I mean, you know, that would just go away. Or it didn't happen until the fiber optic business got going. And of course, that's been a real boon in the communications industry too. But anyhow, those are some of the things. When I was in training, we did not have pacemakers. We did not have artificial heart valves. We certainly didn't have any heart transplants, you know. I would say that the developments in medicine have been very, very good. But the old hands-on family doc has gone to the wayside. I don't know how many of you have seen the doctor in the last year, but I'll bet you a nickel that you haven't had his hands placed upon you. I mean, they look and listen, and then they say, well, let's get an MRI. That, by the way, that's another development, CTs and MRIs. About the hospital, Baylor Hospital, well, first of all, our hospital was a city-owned and operated hospital until 1982. Baylor Hospital System bought it and renovated our hospital. They plowed $5-6 million into our facility here and had it until 1998 when they walked away from us. We still own, they deeded the hospital building back to the city, and the city owns the building. And of course, later on had bond election, and we own the current hospital building, but we have a long-term lease by a company that operates the hospital. Medical Arts Clinic. I was very close to Lewis Gibson and referred him a lot of patients, and referred a lot of patients to the clinic in Corsicana. They were crazy enough to let me be a part of Medical Arts Clinic in 1975, and at that time we started looking for another physician, and there he is. Yeah, he's number 13, by the way, and it was a lucky 13. The Moody's helped us attract them here, and there were a lot of other people. Yes?
For the video, could you introduce Dr. Lee?
Okay, this is Dr. Bill Lee, was one of the Medical Arts Clinic physicians, and he saved our lives. Now, I got to tell you about that. The last 6 months before he came, a couple of years before that, I had built a retaining wall around our lower garden. 13 tons of stone. And Scott, our son, and I built that retaining wall. Well, a couple of years later, I paid the price, and I sneezed, and it was like somebody stabbed me in the back with a poker. Anyhow, I worked for 6 months with herniated disc, and it was just terrible. And anyhow, he finished his residency just before the end of the year of 77. And they were in the process of moving here 21st or 2nd or something like that. I was in bed. I couldn't move. And the next day, it was a little better. I delivered a baby from a wheelchair, Christmas Day of 77. And bless Bill and Janice's heart, they came, and the first day he practiced here, he had to make rounds on my nursing home patients the first of the year of 78. January 1st of 78, yeah. Anyhow, I'm sorry?
60 patients.
Oh, okay, all right. 60 patients. Well, anyhow, I did have my surgery and I did recover, thank the Lord. And we continued there as part of Medical Arts Clinic until actually October 1st of 2006. And then we shut down the facility here. Dr. Lee moved to Corsicana for a while, and then later came back here. And that's the end of the story, okay? I don't have any further comments to make. Do anybody have any questions? Yes?
I guess so your practice pretty much was always in the second hospital, right?
Yes.
Because that's about what
Yes. No. The first hospital had been torn down. Yeah. That's right. We had a little trail. It looked like a cow trail from the clinic over to the hospital. And of course we had a number of doctors here that came and then went. But at any rate, it has been a wonderful place to practice medicine and a good time to practice medicine as far as I'm concerned. I think that now is a different era. And some things are better, some things are worse, Thank you very much. Yes?
I will say, I completely agree with you about doctors today.
Uh-huh.
I went for my annual checkup, and all they did was read all my lab results.
Yeah.
I left thinking, I put on clean underwear.
Right. Exactly true. Exactly. Really. Well, we did physical diagnosis for real, and I mean we found problems. You don't find them if you don't look for them. Yeah. Okay. Any other questions? Yes.
Most of the time it's a PA that you see, medical or
Okay.
nurse practitioner. You hardly ever see the doctor.
Well, that's one of the fortunate things. Okay. The economics of medicine. Our granddaughter is practicing medicine over as part of the Baylor healthcare system in Waxahachie at the Family Practice Clinic. She's there 3 days a week, but she has PAs too that see patients and sort of triage them, I guess you would say. And it's good and it's bad. I think that I like to see the real doctor, frankly. But you got to know the right things to say to get in to see him. I mean, it hurts here or there, whatever. Okay, any other questions?
By the way, you did deliver me in 1971.
Hey, how about that? Stand up and take a bow. Okay, all right.
Anyone else?
And I was born in that old hospital,
Yeah, okay, all right. What year?
55.
Okay, all right. Actually, the year I came in 64, the new hospital opened April of 63. And it was a nice little hospital, really. Okay, what did you have? A question?
I had a question. You didn't talk very much about your military career. Could you tell us a little bit more about that?
I went into the Air Force as a temporary captain, and I had a practice there in the Air Force at Plainfield, Washington, which is a small base which no longer exists. It's where the Boeing big wide-bodied plane factory is there in Everett. But anyhow, I did have the opportunity to go back and take a course in flight medicine in San Antonio. And so after that, I was a flight medical officer, not a flight surgeon, but a flight medical officer. And I went down at the squadron briefings and that kind of stuff, and had several aircraft accident investigations and that kind of stuff. So, and like I said, during the Cuban Missile Crisis, I heard them go through the authentication process to fire their GAR-11 nuclear-tipped missiles. Now, that is scary. And it only takes one person. You know, the F-102, which was our operational airplane, is a single-person plane. He's got to fly the plane, got to aim the missiles, fire the missiles, you know, and that kind of stuff. One person. So I don't recall exactly how they went through that, but they were talking about that anyhow. Any other questions?
What is a flight medical officer? What did you do differently?
I did the physical exams on all the flying people on the base, and I had to fly 4 hours a month to get my flight pay, but I wasn't a pilot, so I was always in the back seat of the T-33 or in the jump seat of a C-119 or we had an old C-47 that was older than I was, and we'd fly in it every once in a while, but that was the difference, really. Not a great deal of difference. Any other questions? Yeah.
You mentioned Dr. McCall.
Yes.
And Dr. McCall delivered me in 1951.
Okay. All right.
And did you mention that his father was also a doctor?
Yes. Yes. There's a picture of his house somewhere here.
Well, I had the picture of the house.
Yes.
There, but I wasn't sure that he was a doctor.
Yes.
But I do know that when I was a child, I remember going up to that building that David mentioned.
Yes.
To his office.
Yes.
And I also remember that when Dr. McCall was not available, my mom would take us to Dr. Clark's.
Okay.
His father was also.
Yes. I had some professional activity with Dr. Clark in regard to his wife, but that's a different thing.
Well, one of the things I'm trying to do is to mention as many names of Ennis doctors as I can, so for our record.
Yes. Yes.
So I know there was
Yeah.
Dr. Scrivonic.
Dan and E.J. Scrivonic, brothers. Okay.
You mentioned Dr. Thomas in that picture.
That was Dr. Jeter's father-in-law. That was Mrs. Jeter's father. And like I said, he delivered, wait a minute now, the gangster out that came, Clyde Barra. He delivered Clyde Barra at his house out in Tellico. Yeah.
But tell them about what happened in the other delivery room when you delivered the triplets.
Okay, I'd forgotten.
Jeter was delivering a baby, and they delivered one, and someone.
They were on the way back to the recovery room, and somehow or other there was another one there. Yeah, yeah, yeah. Well, I had a singleton, yeah.
Baylor Hospital, there would be 30 people in
Yeah. Yeah, I had a singleton. Yeah, okay. Okay. Life is good.
Can you kind of talk about how insurance has influenced medicine?
Oh, yeah, that's tough. And of course, there are all kinds of insurances. There are things that have panels of doctors and those who have just any comers. And if you get on some of these specialized Medicare programs, you don't know who's going to accept it and who's not. And I remember when this first came about, I had some elderly people that had bought insurances, and the closest primary care physician was Red Oak. And so, you know, anytime you do some of these unusual Medicare supplement things, be sure you know that your doctor's in that section that accepts it. Yeah. And actually, the insurances do get involved with the practice of medicine in that they approve or don't approve of certain treatments or medications or procedures, and you have trouble getting over that. I mean, if they say no, it's a no, you know.
When you first started, how many people had insurance?
Very few. If it hadn't been for Medicare, I'd have starved, really. But if you look now at medical facilities, my goodness gracious, there are just billions of dollars being spent on facilities and people. And I've got my grandson's wife is over in Africa now trying to recruit nurses. That's how bad the nurses shortage is. And the same is true of physicians of certain types. Actually, primary care physicians, there's a big shortage. Everybody wants the big doctors, or the big dollars. So they're going into rheumatology or vascular surgery or whatever. You know, and that's too bad, really. Okay. Any other questions?
What's the population of Ennis when you first started?
9,500 or so, but that did not include Sonoma, which was east of the highway. Yeah. Okay, listen, thank you very much.